Okay. Hello. So, hi. I am Miss Jones. I am a nursing student here in Maryland. I hmm, okay. So this is my first time recording a video. I'm a nursing student. I'm currently in Med-Surg 1, thankfully. Uh, and I decided to record this video because we're in a new unit and I want to be successful. Med-Surg, I hate to say that it's a hard class, but it's a lot of information. And I had to come up with something else. I'm a reader. I read and take notes. That when I study that way, I'm normally very successful. But in this class, I've done that, and it's just not translating over to the test the way that I wanted to. And not to make an excuse for myself, but something is not within my program at Med-Surg 1, there's a disconnect because not only myself, but people, everyone in that class is bright, but there are people that I know who are some really smart people who can retain information and pull that information out, and they're having problems. So instead of complaining, because if you're a college student, especially if you're a nursing student, I don't care what program you're in, there's some bullshit with those programs, right? It's just some stuff that you be like this stupid, this don't make no sense. But they have a method to their madness. But again, I this is I have to get creative because I'm not going to let the nursing program defeat me. And if you're a nursing student, you know what I'm talking about. Can't let it defeat me because I'm going to be an RN. So I've decided to verbalize my notes instead of just writing it down, going back, reading it over and over and over again. Because, like, again, these disease processes, it's a lot. They just don't present one at a time. We'll probably talk about, I would say, 3 or 4 disease processes that are associated with the endocrine system, which is the unit that we're currently on. And a lot of times, within a particular body system, the symptoms, from what I'm showing, they all present the same way sometimes. So it's like a different um, disease, but it may present the same way as something else. So the patient may present the symptoms the same way. So I'm going to go ahead and get into it. Again, we're on a new unit. We're talking about the endocrine system, and the first disease process that we're going to be talking about on this coming Thursday is diabetes. So before we talk about diabetes, I really want to talk about insulin and glucose. So this would be a short video. I'm just going to briefly talk about what insulin is. So insulin is a hormone. It's a hormone secreted by the pancreas. Now, a hormone is a chemical signal, and most people know that hormones are associated with the endocrine system, right? So again, insulin is a hormone. It's secreted by the pancreas. Insulin is needed to regulate blood glucose. Glucose is a sugar. So after we eat, our blood glucose level, the glucose that's within our blood, increases. And that's normal. I want to say that. That's normal, obviously, right? Now, insulin has to be responded to. So the pancreas is going to send out insulin, which is a hormone, after we eat because blood glucose is going up. Blood glucose has to stay within a narrow range. You're a nursing student or A&P student, you've heard of homeostasis. We have to have balance. So when insulin is secreted, body cells take in that glucose. They remove that glucose from the blood. Well, not all of it, but they remove what they need. And then they use that glucose to run their cellular respiration process, which is the process that will generate ATP. ATP is energy. You need energy to live. And I'm going to leave it like that. Now, glucose, let's talk about that quickly. Glucose is a monosaccharide, and it's important to talk about glucose because you have to understand that glucose is the preferred fuel, going back to the cellular respiration. So the body needs glucose. Body cells, I'm going to say that body cells need glucose to run their cellular respiration process to generate ATP, which is energy, which is life. You'll hear me say blood is life, and also you've heard A&P instructors. And if you know me and you went to my college and you had the A&P had A&P with Dr. Malaki, you know he constantly always said that ATP is life. ATP is life. If you heard nothing else that man said, you heard that. So it's important for insulin to be secreted because body cells will only take in glucose if they're told to by insulin. Insulin instructs body cells to take in glucose. Now, body cells use insulin for cellular respiration to generate ATP. But then insulin also tells muscle in the liver to store glucose. Okay, now again, glucose is an important body fuel. Most cells will use glucose to run their cellular respiration process. Now, there are cells, very important cells in our body that will only use glucose, which is why we store it, which is why insulin tells the liver and muscles to store it. Because there are instances where when we're not eating, we're fasting, right? So when we, forgive me, when we need glucose, the muscles and liver will break it down. Well, let me say this. The muscles and liver store glucose as glycogen. Glycogen is the storage form of glucose. So when we need glucose, we have the store. We have the liver, we have the muscles. It can be broken down, released into the bloodstream when we need it. And again, insulin will tell those two tissues to do it. So now the nervous cells and the red blood cells, this is why glucose is, understanding this part, what I'm getting ready to say is so important and critical, is because our nerve cells and our red blood cells will only use glucose to run their cellular processes. So in order for a nerve cell to function, in order for your red blood cells to properly move oxygen over to your body tissues, it's not about preference with them. I don't even have a preference because I only want one thing. I don't have a preference. This is the one thing I want. It ain't nothing about, I can use, no, give me glucose. That's why we have the store. So you have to understand that, and which is why glucose has to be tightly regulated. It has to be in balance. It can't be too high and it can't be too low. So just to recap, because I don't want the video to be too lengthy because I am wordy and I don't want to, go off track and confuse myself or confuse somebody else. I want to be helpful. So again, before we talk about diabetes, we have to understand that insulin is a hormone secreted by the pancreas. Insulin tells body cells to take in glucose. Body cells take in glucose to run cellular respiration. Cellular respiration has to be performed in order for us to live because glucose is the preferred fuel to generate ATP. What did I say? ATP is life. ATP has energy. Once it's generated, it has energy in its bond. And ATP is in a phosphate is broken off of, because ATP is adenosine triphosphate. In the cellular respiration process, a phosphate bond will be broken off of ATP, energy be released. You will live. Forgive me. Now, again, so we know what insulin is. We know that glucose cannot stay in the blood. because it has to be stored. Because if it stays in the blood for too long, the kidneys is going to take it up. See, I'm going too far. But the kidneys is going to take it up. It's going to be secreted in urine. That's not good. So remember, we need insulin to tell skeletal muscle and the liver to store it, because for any chance, like during the times when we're not eating, after we ate breakfast, after we ate lunch, after we eat dinner, anytime that we're not putting food, particularly carbohydrates, into our mouth, we don't have enough glucose in the blood to run cellular respiration, which runs all the time. So we have those stores. And in long periods of when we're not, like, let's say you go 2 or 3 days, you say you want to do a fast, which you can. You just kind of want to be mindful. I would say if you're going to fast, just eat fruits and vegetables, to be honest with you. There's your carbs. But in times when a person is starving, skeletal muscle in the liver are going to be signaled by another hormone secreted by the pancreas to break down that glycogen. I didn't mention fat because I don't want to go too far off, but fat is also takes in glucose, instructed by insulin to take it in, but fat converts glucose into fat. You knew that because you know when you eat a lot of carbohydrates, you get fat. That's why people go on low carbohydrate diets, which is a good way to lose weight, but you can't maintain yourself on that. You kind of see how those people look. Like, they look good in the beginning because they lost the weight, but then they just start looking gray. They don't look good, and it's a particular reason. Because, and I'm not going to go into that. I don't want to go too far, but just to wrap up, again, glucose, an important body fuel, the preferred body fuel, the only body fuel that nerve cells and red blood cells will use. If by chance we're in a glucose deficit, we don't have enough glucose, meaning we have not taken in enough carbohydrates, or we are in starvation mode, the body will break down its glucose stores, which is in the muscle and liver. And when we get to that state, we can go ahead and take the glucose, send it to the body cells that needs it, and we can continue to live. We can, because ATP is life, right? We can continue to generate ATP. Insulin, again, controls blood glucose. Without insulin, glucose will remain in the blood, which now, if that happens for whatever reason, I'll say that now, for whatever reason, body cells aren't responding to glucose. Glucose is not being secreted by the pancreas. We have glucose sitting in the blood. And now we can move on to diabetes, because now we need to know what are the implications. What will happen if glucose just sits in the blood? Body cells don't take it up to generate ATP. The muscle and liver don't take it in to store it. Just if by chance we don't ingest enough carbohydrates and we don't get the glucose we need, we don't break down that carbohydrate to get the glucose we need. So in the next video, I'll talk about diabetes, and I also will hopefully be clear, not as wordy. This is now going into 14 minutes, and I feel like I've said the same thing over and over again. But I'm glad that I am, because it's helping me to understand, and I hope it helps. If it only helps one other person, I've done my job. Amen. So now we understand the importance of insulin, the significance of glucose, and now we can talk about diabetes in a better way. We can understand some of the things that we see with people with diabetes, because again, diabetes is sugar sitting in blood, sugar not moving, insulin not doing what it's supposed to do, not signaling, not telling, not instructing muscle, liver, fat, body cells to take in that glucose to do what they need to do with it. Thank you for listening. Hopefully, like I said, this is my first video. I will only get better because we all get better when we keep doing something. Practice makes it does. I don't believe in perfect, but you get better. You keep doing something. You keep doing it. You keep doing it. You keep doing it. You get better. See how my flow? I started off, but now my flow is a little bit better. You just get better at it. So we got this thing. Thank you again. Bye.